I'm Deb Kimmett, and this is the news brief for Monday, May 16th, 2022. In this video, we cover the developments that have occurred over the last month that pertain to massage therapists. This month, we'll cover more on long COVID, a few miscellaneous items around masks, test recalls, and the J&J vaccine, our usual variant update, COVID rebounding after treatment with Paxlovid, and a few grim milestones. We'll begin our usual way. A shout out goes to the Massage Health Practitioners and COVID-19 Facebook group. They provide accurate, evidence-informed info, and I want to credit them for a job well done during the pandemic. They're just one of many sources that I use to gain information for these news briefs. You'll notice at the bottom of the slides, I have an abbreviated source. The full citation is in the companion PDF file, or what I call the show notes. And before we get into the topics today, remember, science changes, so what we know today may not be what we know tomorrow. This means that the information presented here will evolve and change as we learn more. Also, the information contained in this news brief is informational only. It's not to be considered as medical advice, nor should it be construed as medical advice. Our first topic today is long COVID. There are several subtopics, but the top story this month has to do with the risk of long COVID and if you've been vaccinated. We know from previous news briefs that being fully vaccinated, including being boosted, lowers the risk of getting infected or getting a severe case. But the burning question that I've had is what's the risk of getting long COVID if you've been fully vaccinated? A new large study out in the US confirms that yes, if you've been vaccinated and get COVID, the risk of long COVID, hypertension, diabetes, and heart disease is lower than if you were unvaccinated. The study looked at almost 1.58 million COVID cases. The authors compared vaccinated and unvaccinated groups at 28 and 90 days. For long COVID, we're more interested in the 90-day comparisons. Note that these are new conditions and new symptoms that showed up after being diagnosed with COVID, and you'll see that along the left side of the chart. Across the top of the chart, we're comparing the number of cases per 1,000 people infected with COVID. And the right column discussed the risks for the unvaccinated. And what I did with that is I took the number of unvaccinated people that got a certain condition and divided it by the number of vaccinated people who got it. And so, for example, with regards to hypertension, 6.42 out of 1,000 people infected with COVID developed hypertension, whereas it was 19.59 for the unvaccinated. What that means is that your risk of getting hypertension if you're unvaccinated is 3.1 times higher than if you're vaccinated. And so when you look at the other conditions, diabetes, heart disease, thrombosis, you'll see that those numbers are significantly higher. And new symptoms that you get since being diagnosed with COVID, like respiratory symptoms, headache, fatigue, and body ache, the risk of getting those symptoms is much higher if you're unvaccinated versus being vaccinated. The massage therapist takeaway: the risk of a vaccinated person developing long COVID, which is officially known as post-acute sequelae of COVID-19, or getting new symptoms, or having new conditions as a result of COVID, is significantly lower if you've been vaccinated, which is yet another reason to get vaccinated. So if you want them, and if you can have them, we strongly encourage you to get vaccinated and stay up to date on your boosters. In other long COVID news that pertains to massage therapy, an opinion piece by a former community hospital bioethics consultant explores whether alternative approaches can help with long COVID. He asserts that the jury is still out on this, but that it should be taken seriously and is something to explore until conventional medicine can catch up. For example, he points out the similarities between long COVID and what are called contested diseases, like chronic fatigue, and how it takes time for conventional medicine to catch up, like how chronic fatigue was finally studied in depth And in 2015, it was determined that it was a real disease and renamed myalgic encephalomyelitis. It's a pretty good read. The importance of the article is that the medical community is looking to us and other therapies to fill the gap. The massage therapist takeaway: keep doing what you're doing. Provide your best evidence-informed care because it's being noticed. Another article points out the severity and risk for long COVID among those who had severe cases, meaning those that were hospitalized. In Wuhan, China, it was found that 55% of those who were hospitalized still have at least one symptom after 2 years. The most common symptoms are fatigue or muscle weakness. The massage therapist takeaway: keep doing what you're doing. Provide your best evidence-informed care. If your client has been previously hospitalized with COVID, continue to screen for symptoms for 2 years or more. Always ask your clients about COVID, even if it was longer than that. Then that brings us to long COVID and poop. In a new large study, researchers found that 4% of patients still shed the virus in wastewater up to 7 months later. This is significant because it gives credence to the idea that one of the causes of long COVID may be that it hides out in the body in reservoirs. If you remember our deep dive on long COVID in February of 2022, I talked about this as one of the 4 potential ways that long COVID may be caused. And an article in Nature cites this same study, plus another one that provided evidence that immune system cells were still responding and changing, indicating that the virus is still present in the body at least 6 months after the initial COVID diagnosis. The massage therapist takeaway: we still don't know all of the causes for long COVID. Each long COVID client may present differently with different causes, so we need to treat them individually to meet that client's needs. And the final long COVID topic is an article that outlined a really good summary for risk assessment of getting long COVID. It's an opinion piece in the Washington Post, and the author was on the COVID-19 advisory board for the Biden-Harris transition. The article is important because he puts together some very important information, and I've included these in quotes in the show notes for you as the stats are important. I've also left in the links for the stats and the studies he cites so you can follow them if you want. In short, the pandemic is not over. Quote, we still do not know enough about the complications that come after initial infection. What that means is that we don't know enough about long COVID at this point to just ignore all of the precautions. And that long COVID is still a risk. Estimates range from 0.5% of infections to 30%, with 10% being a commonly cited risk. The vaccines seem to help reduce the risk of long COVID, but they don't make it uncommon. Again, the data is highly variable. A Veterans Affairs study estimates vaccination lowered the risk by 13%, while 2 British studies estimated 40 to 50% lower risk. Maybe the best study, involving more than 240,000 US patients, suggests that vaccines cut the risk of long COVID from roughly 17% to 3%, and that's not rare. There are a few more stats that he cites that put long COVID in a better context and puts it into perspective, okay? If you get the J&J vaccine, you have a 1 in 300,000 risk of getting clotting. If you have the J&J vaccine, you have a 1 in 2 million risk of dying from it. And the FDA has restricted these at those odds. And we're going to talk about that later, okay? But your chance is 1 in 33 of getting long COVID after a COVID infection, which basically is telling us that the risk of getting long COVID is not rare. Some other perspective on this with regards to raw numbers: it's been reported that 189 million people have gotten COVID by the end of February. We're going to talk about that in a moment too. So if 1 in every 33 of those people get long COVID, that's over 5.7 million people. In short, He's saying that the risk of long COVID is pretty high, which is your massage therapist takeaway. The risk is pretty high. Protect yourself by following masking and ventilation protocols. Moving on from long COVID, let's talk about mask mandates. There's just a quick update on this. The mask mandates on public transportation were struck down in court at about the time of the last news brief. The Biden administration is appealing that ruling because of the precedent it could set. The CDC has the authority to step in as a matter of public health, and if this ruling stands, it could keep the CDC from using its authority when a future health crisis hits. So that's why they want to appeal it. I've not seen anything else in the press on how the case is proceeding because such cases take time. And in the meantime, that's leaving us with a patchwork of policies as cities try to figure out what to do. Since summertime is travel time, I thought I'd take a moment to talk about protections on airplanes. Jetalina of the Your Epidemiologist blog analyzed the filtration system on airplanes, and she pointed out a few key things to keep in mind as you travel. First, planes have good filtration, but airports don't, so you can be exposed there. Second, the filtration systems in planes are not turned on during boarding and deplaning. That's another exposure. Number 3, you can inhale the virus before it gets to the plane's filters. And fourthly, the filters aren't effective against droplets, which means that if someone sneezes nearby, you're in trouble. But rather than focusing on how you can get the virus when people aren't masking, Romano makes the case for one-way masking, where you mask and others around you don't. Romano concludes that yes, one-way masking does work if you wear an N95, KN95, KF94, or better mask that is well fitted. The massage therapist takeaway: massage therapy is similar to public transport. We're in a small space together for a period of time. Masks and ventilation work together. Wear an N95, KN95, KF94, or better mask. Make sure it's well fitting. Mask mandates may be over, but there's nothing keeping you from continuing your protocols. Mask up and ventilate for safety. The next quick topic is test recalls. There are 2 COVID tests out there that I've never heard of before that have been recalled. The SkipPak Medical Lab SARS-CoV-2 antigen rapid test was recalled for the simple reason that the FDA didn't authorize or approve it. And the Acula SARS-CoV-2 PCR test by Mesa Biotech has been recalled due to contamination issues. The massage therapist takeaway: make sure you're using FDA-approved rapid antigen tests and pay attention to recalls in the press. And on to our next topic, the J&J vaccine update. Along this same theme of recalls and restrictions and so on, the FDA has limited the use of the Johnson & Johnson vaccine because it can lead to a rare blood clotting disorder. We've reported this issue before, and it's been reported in the press before, and what's changed is that it went from a CDC recommendation to use other vaccines back then to now the FDA mandating that its use be limited to people who, first of all, don't have access to other vaccines or are unable to take other vaccines. For example, those who are concerned about an anaphylactic reaction to the mRNA vaccines. And secondly, those who don't want the other vaccines or wouldn't get the vaccines otherwise. Just as an aside, the articles for this topic confirm the stats mentioned previously under the topic of long COVID. The massage therapist takeaway: the J&J vaccine is no longer a first choice vaccine. We suggest waiting 2 to 3 weeks to treat someone who's had the J&J vaccine. It seems that 2 to 3 weeks is the window in which the clotting issues will appear. And to just be on the safe side, we recommend waiting that long before you treat them. And in our monthly variant update, as of May 7th, BA2 and its subvariant BA2.12.1 make up 99% of the reported cases. These are both subvariants of Omicron, and there are other Omicron subvariants in the news now, BA4 and BA5, which are at low levels here, but are picking up steam in Africa. Scientists seem to think that BA4 and BA5 could lead to a new wave. Our massage therapist takeaway is that there's no need to be overly concerned about variants at this time. The current variants are making their way through the US, and BA4 and BA5 may cause a wave later, but they're not a concern in the US at this time. And also we want you to keep on doing what you're doing. Keep up your usual precautions. Another major topic is COVID rebounding after treatment. Some COVID patients are experiencing a return of COVID symptoms after finishing a course of Paxlovid, a treatment for COVID that lasts 5 days. During the clinical trial, there was a 2% rebound rate, meaning it was rare, but now anecdotal evidence of rebounding is coming out, leading some to think that it may be more common than just that 2%. And since the rebound rate was similar to the placebo group, this means that it's unlikely that the rebounding is due to the drug itself. So far, the incidence of rebound is uncommon, but researchers are following this and trying to figure out just how common or uncommon it is, because there are more and more anecdotal cases out there. We just don't know what's going on because there's a lack of data, but there are several hypotheses as to why this rebounding is occurring. For example, 5 days may not be enough time for the drug to work, and that's how long the current course of treatment is. The treatment may be given too early in the course of the disease so that secondary immune responses don't kick in after the drug is stopped, and then that's why symptoms come back. Omicron may behave a little bit differently than Delta, which is when the study took place, and people are just simply getting reinfected. Researchers don't think that drug resistance is the cause, but there's not enough data yet on that yet, so they don't know whether people could become resistant to Paxlovid or not. So here's what you can do if you've been on Paxlovid. If people experience a rebound, both the FDA and the drug manufacturer, Pfizer, say that you can get retreated. So go back and get retreated. In a previous news brief, we've talked about rapid antigen testing as a condition for leaving isolation. Jetalina now recommends that if you do take Paxlovid, that you take rapid tests on days 2, 3, and 4 after you've finished your Paxlovid treatment to ensure that there's no rebound. In closing, Michael Mina, in an interview, wants to stress that this rebounding is not a failure of the drug because the drug itself is highly effective. What might need to happen instead is a change in the treatment regimen, meaning that people need to be on the drug for longer to fix the issue. The massage therapist takeaway: if your clients have taken Paxlovid and they're experiencing a rebound in COVID symptoms, send them back to their doctors as soon as possible so that they can be retreated. Or their doctor may decide that they don't want to do that, but you're sending them back to the doctor. If you've taken Paxlovid, Jetalina recommends rapid testing after you finish the course of treatment on days 2, 3, and 4 before ending isolation. There are 3 grim COVID milestones that were reported this month. First of all, the US has passed the 1 million mark for deaths from the virus. The map shows losses per 100,000, so there's a clear comparison from state to state. The darker the color, the higher the death rate. That puts Mississippi, Arizona, Alabama, and West Virginia with the most deaths per capita in order. From a sheer number standpoint, the states with the highest losses by population in order are California, Texas, Florida, and New York. Another grim statistic: worldwide, there have been 15 million excess deaths due to COVID. Let's look at this for a moment. This number represents the differences in death rates between what would normally be expected had COVID not happened and what actually happened because COVID did happen. The World Health Organization came up with this estimate. It's double the official total of COVID deaths. So why so many more? The additional number is due to COVID deaths, uncounted COVID deaths, and people who died because they couldn't get the care they needed due to COVID overwhelming the healthcare systems. They didn't get emergency care, care for the chronic illnesses, or mental health care. One expert said that, quote, among high-income countries, the US did the worst, unquote, on this stat. And the third grim milestone is that nearly 60% of the population has been infected with the virus. These results are based on blood tests that could tell the difference between antibodies that came from being infected versus antibodies due to vaccination. One would think that this is a good thing when it comes to fighting the virus. The number, however, is grim because, first of all, it's double the official case count, meaning that a lot of cases are asymptomatic, meaning that it's hard to control the spread. Getting infected does not mean future protection. People are getting reinfected, and as a result, there's no known number for herd immunity. To refresh your memory, herd immunity means that the spread of the virus is mostly controlled. And in COVID's case, because people can get reinfected, herd immunity is going to be nearly impossible. The massage therapist takeaway from these three doom and gloom numbers is that COVID is not done with us yet. And keep doing what you're doing. Keep up your usual precautions and hang in there and keep safe. And finally, on a housekeeping note, those COVID spreadsheets that I developed for keeping track of the local stats, they help you keep track of what safety precautions to follow and when to follow them. I've updated them a bit. I've added columns for wastewater surveillance and hospitalization so you can keep track of those trends too, because they're important as case numbers become less and less reported. The link to those are in your show notes. And that's it for today. Thanks for watching. And again, please remember that science changes, so what we know today may not be what we know tomorrow. Stay safe and be healthy.